Next stitch I'm going to be showing is a variation on the running stitch, and this is called the running locking stitch. It starts the same way that the running stitch does, simple interrupted, or tying it off at one end. So I'm going through here, going to the other side, about an eighth of an inch back from the edge. See, I'm a little close. Nothing wrong with backing up and going in a little further back from the edge. It's certainly legal to do that, and it's going to allow you to do this properly. Okay, again, I'm going to tie this one end off to itself. One wrap, two wraps, three wraps. I grab it below where I'm wrapping, pull off my loop. Here's my first loop, and then I'm going to do my wraps above it here. Okay, grab the loop, I then pull off my second knot. And that knot will sometimes get a little clumpy looking because of things that are happening in the area, but generally this can be done quite nicely. And this one will have to play with me. Okay, pull my third knot off. Make sure all knots are laying right over each other. Tie it off. Pull it snug again. That's now my anchor point. Tie it up fairly close. You don't leave a loop left on the suture material. This will have a tendency on many individuals to catch on a zipper or catch on clothing, which will then perhaps cause this knot to come out. The difficulty with any of the running stitches, and the concern with any of the running stitches, are that if the stitch breaks anywhere along the line, the whole stitch will come loose and the wound will open up again. So that is one of the disadvantages of this. I'm going to reach forward just like I did with my running stitch, about a quarter of an inch, pop through from the side, come up directly opposite, okay, come through just like I did before. So this would be my standard running stitch. What makes the running locking stitch different is that I pick the loop up a little bit here, and I run my needle through that loop from the unfinished side back towards the finished side. I pull it across the skin, pull it back down, automatically everse the skin a little bit, okay, and gives me kind of a square look to it, which is very nice, very professional looking, very clean looking, which many people prefer. I then go ahead and just continue the same process we did before. Pop through, come up directly opposite, okay, pull the loop through, go back through that loop, pull the skin across, pull it back down again. Notice you're getting some nice eversion on the area, nice clean line looking across the bottom. A couple more of these so you can see how it's done. Same thing, reach ahead about a quarter of an inch, pop through the skin, come back directly opposite all the way through. Okay. Now, as I pull this up close, sometimes people wonder, well, where do I go back through it? Remember, you always want to go back through just the very end right here, because this side is still part of the previous loop. So you want to go right to the end, take your needle underneath, go through, try not to stab the patient. I tend to pull it across to snug it up, okay? Pull it together, make sure the ends are nice and snug. Okay, I'm running out of thread, so I'm going to basically close it off here, but you get the idea what I'm looking for. Here, I want to make sure this is all nice and tight, so this horizontal line, or line that's parallel to the incision line, should be right down the base. I want to snug it up a little bit to make sure it's always nice and snug like this. And you can see it's going straight across. It's a nice clean looking stitch. I would carry this to the end, but I'm running out of thread, so I'll just demonstrate the closure right here. And here I do my 3 wraps. Okay, grab with my other fingers, free up my thumb and index finger. And here I can't just grab onto this thread and tie it off because it's going to basically loosen up. So I have to grab it right here or grab it right there and tie it off. So I'm going to grab right down here, tie it off, pull mine, keep everything tight, pull it off. You notice it buckle a little bit. That's fairly common, especially if the skin is soft like this pig is, or the person has very soft skin, soft, delicate skin. And it closes up, and we're done with it. Again, make sure the edges are nice and tight along here. The skin is nicely everted, you can see that. And this will be done perhaps right at the end. Notice that there's a little bit of slack here, but that's because the loop slipped a little bit, and that is not uncommon to see that. But that's your running locking stitch.